live in a mecca of medicine, home to some of the world's best hospitals and most gifted clinicians. And so it's not surprising when we read about a medical breakthrough with local ties. It is unusual, however, to hear a doctor refer to a patient this way. As a physician, I never liked the word miracle. I preferred to think in terms of medical outliers. And yet that day of the wedding did feel like a miracle. That's how my next guest described watching a terminally ill patient who got the chance to see her daughter get married right in the intensive care unit. Haider Warraich is a resident in internal medicine at Beth Israel Deaconess Medical Center. Welcome back to Greater Boston. Tell us the story in brief, if you would.
Thank you, Ron, for having me on the show again. So the story really started in the middle of the night. I was in the intensive care unit, and we got this admission from the emergency room, and the patient was a very, very sick middle-aged female, and she was actually she had a long battle with cancer. This was her third cancer, and she just failed another round of chemotherapy. And you thought she might not survive. She was. It was like wherever we looked, we found some disease. When we looked in her lungs, we found a clot there. When we looked at her blood count, she had no white cells to protect herself. Her intestines had an obstruction, and that was my fear, that she may not even make it through that hospitalization. But then what happened? And what happened was, I went up to her, I spoke to her, and she was a bit confused, and that may have been an effect of the illness. But the only thing that she was able to tell me very, very clearly was that she wanted to make it until her daughter's wedding. And then? When I asked her when the wedding was, she said it's next summer, and this was about 8 months away. And when I heard that, I felt very, very sad because, to be perfectly honest, I didn't see that happening at all. I didn't see her even make, again, as I mentioned, I didn't even see her making it through that hospitalization. So, but with that knowledge, we managed her, and we tried to do whatever we could, but knowing that there was little hope that we could really achieve what she had wanted out of her own life. And then out of, as if almost out of the darkness, and through a series of events, the fiancé of the daughter decided to propose to get married in the ICU during that hospitalization. And you intervened to help move things along, get the marriage license. There were nurses who brought flowers. It was a big team effort in the hospital. It really takes an entire village to get anything done, especially a wedding. And I mean, I was thinking about how many people are involved. There were at least close to 40 or 50 people involved in some shape or fashion to bring this together. We had the social workers. They were very, very involved in talking to the family, figuring out the details. The cafeteria made the best chocolate cake I've ever had. Tell me how the patient is now. Well, I just talked to the daughter. I actually met her just this Friday, and the patient is currently in hospice, and she is, according to the daughter, as good as she can be. Remarkable, isn't it? Right. 4 months on from that dark night. Have you ever seen anything like this before? Well, I've never seen anything like it, but I really, really hope to see more of such instances in the future. Dr. Haider Warraich, thank you very much for joining us.